When I was a medical student, I had a dream to become a cardiologist. I wanted to be a member of the American Society of Cardiology. I knew that a cardiologist was making a lot of money in the US. Honestly, I didn't want to work in my country where the doctor was very poorly paid. Unfortunately, after my studies, I was assigned in a rural area, hardly accessible, and therefore, I had no more access to all the facilities that would help me realize my dream. I saw people dying because they had no way to pay for the care, and I was always discouraged and angry at the government that are accused of not doing anything to improve my working conditions, and against people who prefer traditional medicine and came to the hospital late. But hearing President John F. Kennedy says in his inaugural speech, "Ask not what your country can do for you, ask what you can do for your country." This sentence showed me that I spent my time complaining and judging others, yet was not taking concrete actions to improve the quality of health of the people I was in charge of. From that day, I regularly go down to the community to have a free consultation all those patients who could not come to the hospital, conducting outreach as well as HIV testing campaigns and so on. My interest in public health field became increasingly broad, and I saw how concrete actions can have a positive impact in the community. In 2014, Cameroon was hit by a polio outbreak, and as district medical officer, I had a responsibility to have all children under 5 years of age in my area immunized against poliomyelitis. This public emergency allows me to figure out how fragile our healthcare system is. I asked myself, why do you continue to have outbreak of disease that can be preventable by vaccination? What is my contribution to reduce this disease? I'm sure you know that in the world in general, and in sub-Saharan Africa in particular, several 100,000 children are not vaccinated. Many start vaccination but do not complete it. This unfortunate situation is related to the fact that the target to be vaccinated is not accurately controlled, the unavailability of vaccines in the most remote areas, migratory movements, and political crisis. For 2016, according to WHO report, there were 36,000 cases of measles, 100,000 cases of mumps, 5 cases of poliomyelitis, and 1,000 cases of yellow fever. In order to accurately control the vaccination target and thus better manage our expanded program of immunization, regardless of the health facility where we are, I had the idea to create a software that will help us to address these issues by using electronic medical record. The main function of the software will be, primarily, every time a child is born in a maternity home, we will use the fingerprints to record him in a database, including his demographic data and that of their parents. So we will have the exact number of children born each day in our health facilities and thus know the vaccination target. Secondly, once the child has been identified, the application will automatically generate his vaccination schedule with specific dates. To ensure that the kid has effectively received vaccines, the caregiver has to check the vaccines received as well as the lot numbers. The data saved will be housed in a secure database at the regional or even national level. If for some reason a family decides to continue immunization in another health facility, only by child's fingerprint, it will be possible to have a background of his immunization history. During the last decades, several partners have invested in vaccination and the results are promising, but much remains to be done. I'm firmly convinced that by including electronic medical records in the management of APE, we can improve our immunization coverage, thus reduce disease preventable by vaccination. I invite all of you to join me in making this project a reality. Together, we can reduce early childhood disease by using electronic medical record in immunization data collection. Thank you.